Hi everyone. Today I'm going to talk about chronic fatigue syndrome. Over the 25 years that I've been in medical practice, I've seen so many people with this debilitating illness. And this is where someone is fatigued for greater than 3 months, and the fatigue really affects their functionality. Oftentimes they spend a lot of time in bed and they can't work to their full capacity. They stop being able to exercise or feel good after they exercise. And it's a big problem. So sadly, Western medicine doesn't approach this very well. They don't have a lot of solutions. There's no quick fixes oftentimes. And it's the kind of condition that really requires some deep investigation. So what I've learned is that oftentimes people will have some either chronic infection or a combination of chronic infections, some hormonal imbalances, and some immune dysregulation. So the chronic infections can be viral in nature. So oftentimes a person has a reactivated herpes family virus such as Epstein-Barr, which originally can cause mono in people early on, or a reactivation of one of its relatives like human herpes virus 6 or cytomegalial virus. These are not sore-forming types of herpes viruses, but we almost all are exposed to them. They're pretty ubiquitous in the population. And if we're in good shape, our immune system will keep them dormant. If we get under too much stress, they can reactivate and proliferate in the system and cause almost a low-grade mono-type feeling. So you can have a combination of viral reactivation, or you can have a chronic bacterial infection. And this would be a bacteria perhaps transmitted by a tick, such as Borrelia, which causes Lyme disease, or Bartonella, Ehrlichia, Anaplasma, Rickettsia, even Yersinia. And you can also get chronic bacterial infections that you breathe in, so they're not transmitted by a tick, such as Mycoplasma pneumoniae or Chlamydia pneumoniae. These can exist chronically in the system and can actually go inside of our cells and begin to disrupt energy production in the mitochondria. So it can lead to very fatigued states, as well as generation of inflammatory intermediates, brain fog, muscle pain, joint pain, etc. And then sometimes people can have hidden infections like at the site of an old root canal, or even at the site of a wisdom tooth extraction. And the brewing infection in the jaw, a person can be completely unaware of because they don't have any localized pain, but that can really start to drag a person down. And bacterial byproducts can move from the jaw into the brain and cause significant brain fog. Sometimes people have colonization in their sinus cavity with bacteria or even fungi. So for example, someone can be living in a moldy environment and mold spores can colonize in their sinuses, proliferate there, and really create mycotoxins that leak into the system, again, can go intracellular and dampen mitochondrial energy production. Sometimes a person has chronic infections in the gastrointestinal tract, either a small bowel bacterial overgrowth or a chronic infection in the colon, such as with a parasite or a bad bacteria or an overgrowth of yeast. And then to complicate things further, sometimes people have a combination of all these things. So you really need to figure this out. Now, to diagnose a chronic infection, you have to do some deep digging. And there's been a recent improvement in our diagnostic testing. So having been used in Europe for over 2 decades, T-cell testing has come recently to the United States and is now commercially available. And this is where we can draw a person's blood and send it to a lab. I send it to Infecto Labs in Minnesota. And they can expose the T cells to antigens on the surface of bacteria or viruses and see how your T cells react. So if your T cells are familiar with this pathogen, they'll produce inflammatory intermediates. If they've seen the pathogen in the past, but you no longer have the infection, they will react, but not with inflammatory intermediates. And if they've never seen the pathogen before, they will do nothing. So it's one of these game-changing technologies that will really indicate whether someone has an active infection or not. You can benchmark this, begin therapy, and prove that the therapy is working, as well as determine when you can stop the therapy. So it's a revolution. Now, people with chronic fatigue often have hormonal imbalances as well, either as a primary issue or secondary to the stress of having had infections for so long. And so it's very common for someone with chronic fatigue syndrome to have a deficiency in adrenal cortical hormones. The adrenal gland has worked overtime and now has just pooped out, so to speak. And I'll see diminished levels of cortisol sometimes and some of the other adrenal cortical hormones such as DHEA, pregnenolone, even testosterone. And then those deficiencies can throw, for example, in a woman, the balance of estrogen and progesterone off. So if the adrenals are fatigued, oftentimes that's going to deplete progesterone. The body's going to rob progesterone to produce cortisol, and that's going to lead to estrogen dominance in a female. Or, a woman might be entering perimenopause, and if the adrenals are depleted, it's going to really exacerbate the highs and lows of hormonal swings in perimenopause, which then all of this will very much impact the immune system and the immune system's ability to fight infections. Also, if a person has adrenal fatigue, that can throw the thyroid off and can lead to autoimmune thyroid problems. So a person needs to take a very careful look at the entire hormonal milieu, because your hormones have a profound influence on your immune system. You can think of your immune system as almost on a teeter-totter. On one side, you have the cells that go around and gobble things up. And on the other side, you have the cells that make antibodies to things. Well, the adrenal cortical hormones, and actually some of the sex steroids as well, actually maintain the balance of the teeter-totter. And if the adrenals get depleted, the cells that go around and gobble things up don't work as well, and the cells that make antibodies to things get overactive. This leads to allergies and autoimmunity. And it can lead to just an inefficient immune response that generates an excessive amounts of inflammatory intermediates, which then creates a lot of the symptoms that people with chronic fatigue syndrome have, such as brain fog and achiness and a flu-like feeling, and further incapacitates the immune system's ability to fight the infections that cause this in the first place. So how do you break in? You first need to support the hormones, because that provides a platform for the immune system and for the person to tolerate the stress of tackling the pathogens. And when you do that, then that allows the person to weather it. So then you identify the pathogens and you've got to begin treating them. And in my opinion, there's a small place for antibiotics, let's say in the chronic bacterial infection arena. But when someone's had a bacterial infection for a very long time, antibiotics are not my first choice. I find I get much better results with herbs, oxidative treatments, and general immune upregulating supplements. So I'm not going to get into the specifics of how you treat each thing, because that would take far too long. But I will say it's possible to do it. And if you have chronic fatigue syndrome, I would encourage you to find a doctor that's skilled in functional integrative medicine, that's willing to do this deep analysis with you to really identify the underlying issues that are at play in your situation and treat them appropriately. It can be done, and I've been fortunate enough to watch difficult chronic fatigue syndrome unwound and reversed in so many patients over the years. So have hope, it can be done.